Good afternoon, everybody on the East Coast, and good morning to those on the West Coast. My name is Amy Halale. I'm the Global Education Manager for Zest Dental Solutions. I'd like to welcome everybody today to another edition of Locator Lunch, where we have a quick 15-minute discussion about everything Locator and Locator products, Zest products, highlighting new innovations and a lot of our products. So I am very honored today to be joined by Sonia Stater. She is an amazing dental hygienist that works with us at Zest. Sonia is one of our clinical success representatives and just an amazing wealth of knowledge, amazing clinical support, and an amazing just person to work with. So I'm going to introduce Sonia. Just tell us a little bit about yourself, and thank you for joining me today.
Thank you, Amy. Yes, my name is Sonia. I am one of the clinical success representatives with Zest. I cover mainly a lot of the Midwest. So I have a lot of fun with that, supporting all of our doctors with all of our Zest products. And I live in good old Chicago.
All right, the Windy City. Very nice.
Big old Windy City.
So today we're going to be talking about Locator implants. And, a lot of people don't know that Zest manufactures our own implant line. We are obviously an abutment company. We have our Danville line of kind of products, but we also carry an amazing line of implants. And so that's what I wanted to highlight today, is just talking about what can we do with our Locator implant? What's it used for? Tell me a little bit about it. So, Sonia, tell me a little bit about our implants and what do they look like? And, what are some of the specifications and parameters around our Locator implant?
Our Locator implant is really amazing because, as you can see here, we have a variety of diameters, starting from the smallest 2.4, and it goes all the way up to about 4.9. And you can see it has a very aggressive thread pattern, and it changes as your diameter improves. But the best part about it is that it has the same platform, so you're using the same locator throughout. So you don't have to worry about having different diameters of locators for your Locator implants. And due to that aggressive thread pattern, it's really easy to do your osteotomy when you're drilling, for the drilling protocols for these. I like to highlight the 2.4 and 2.9 specifically for our narrow ridges that we have for our patients. They are really great to use, and that's mainly what my doctors use them for, is for their mainly elderly clientele, and they use the 2.4 and 2.9 for those patients to give them a really great prosthetic that can attach to something. I'm sure we all can think about some little old lady that would utilize one of these implants for their narrow ridge, and you can give her a better quality of life.
So, Sonia, we're actually getting some questions already coming in. Why would a doctor or clinician choose to use a Locator implant over kind of a traditional implant that they're using for single tooth crowns or, crown and bridge?
So, our Locator implant, it's a locator. Everyone knows how to use a locator, and it's a universal locator. Our implant, especially for the 2.4 and 2.9, since it's an external hex, it's one solid piece of titanium. So when we talk about really narrow implants and we have an internal hex, what scares me is flowering, and you're not going to get that with our implant because of that solid external hex, one solid piece of titanium. I do have a clinician. This is what she uses for all of her Locator overdenture patients. And then if it's something else, she uses her other implant line. But for all of her overdentures, she is exclusive to Locator implants. It's just a super simple, easy implant to use. The surgical protocol is super simple, and it can keep your protocols in your office very simple if you would use this for all of your overdenture patients. Like, hey, we have an overdenture patient, go get the Locator implant kit, and you can streamline it very easily in your office.
So talking about a Locator kit, do you have a surgical kit that goes with it? Is it, what type of surgical kit do clinicians need when they're using Locator implant?
So we have a few different surgical kits. We have a surgical kit that highlights mainly just our narrow diameter, that can give you everything that you need for your narrow diameter implants. And then we also have the full kit where you can get all the surgical kit for all of the diameters. And what I really like about our surgical kit is that we have the drill stops. So it takes the thinking out of drilling. So you add those drill stops on there, and it will take you to the depth that you need without accidentally over drilling your osteotomy. We also have a guided kit as well for those doctors that would like to use the guided procedure. I would say a lot of my doctors do, they don't use the guided kit, but I would say you purchase whatever kit makes you feel the most comfortable. What I really also like about our surgical kits is that it has the surgical protocol on there printed. So you don't have to go back and forth or look up a book real quick. It's right there printed on there for you, and everything is really nicely color coded.
Those are great. Those look like, great kits, easy for the doctor to follow, easy for the clinician to, follow and work with. So, when we're talking about that narrow diameter, can you again highlight, what makes narrow diameter implants different than than the standard range or standard diameter implants? What are the size, just reviewing the sizes again?
So the narrow diameter, we have a 2.4 and a 2.9. And then our standard diameter will start at a 3.0 and then goes above that. The narrow diameters, they still have those apical slits, and they're just very aggressive threads. So I tell a lot of my doctors to start with a soft bone protocol so that they don't accidentally over prep their osteotomy, because they're self-tapping implants. So they're really easy to insert into the bone.
Now, when you're doing this surgical protocol, I know you were talking about it, does Zest offer a healing cap, or do you have healing abutments for our locator implants?
So we have healing abutments, and they are in two sizes, 3 millimeters and 4 millimeters. What I do really like about our implant system is it comes in an all-in-one kit. I kind of forgot to talk about that. You can get everything all in one box. You get your implant, your abutment, your housing, and all of your inserts all in one box. So it makes everything really cost effective, which is really great for our patients, because then you can potentially reduce your costs for your patients with that all-in-one kit, which is what I like. You don't need to run around your office and try to find I need an insert, I need a housing. It's all in one box. And what I like to say is, when you open your box, don't throw away the blue cap, because that's where your locator is, and you don't want to accidentally throw that out. We don't want to be rummaging through garbages here.
We don't want to do that. Absolutely not. Now, with regular locators or standard locators, we offer different cuff heights. Do you have different cuff heights for a locator implant?
Yes, we do. So we have cuff heights that range from our lowest, which is a 2.5, and we can go all the way up to a 6 millimeter locator abutment.
And what if a doctor has a locator implant that has a lower cuff and needs a taller cuff? How do you change the different cuff heights, or how can they, get that different cuff height to go with the implant?
So you can order the locator abutments individually. So when you're ordering, you can order your implant and then choose what cuff height you want for your all-in-one kit. And then if you're like, well, I'm not sure if I need a 2.5, so I'll add a few extra other cuff heights with that as well, which is usually how I have my doctors do that. Usually the 2.5 is the main abutment size that doctors will use, and then they'll add a few extra abutments in there in case that they need those for a taller height.
That's awesome. At our past couple of locator lunches, I'm having some doctors ask some questions on. We've highlighted locator fixed, which is our fixed full arch solution. And, we've talked about using these locator implants for their overdenture cases. Can you use locator implants for locator fixed, or is it just for overdentures?
You can 100% use locator implants for locator fixed. It is FDA approved for locator fixed. And I mean, why not? Especially if you've already used a locator implant and that patient wants to upgrade to locator fixed, have no fear. We have a solution for you, because you can do locator fixed on locator implants.
Can you use locator implants in all of the diameters for locator fixed, or is it just the wider diameters?
You can use it in all of the diameters. So it was FDA approved for 2.4 and 2.9.
And that's excellent, because I know a lot of companies, don't make a locator for that narrower ridge. And a lot of patients are having a hard time accepting full arch treatment because that ridge is so narrow. So that's an excellent solution.
Absolutely. And with that, I will talk about a case that I most recently worked with a doctor. Immediately after she she placed her implants, she messaged me immediately and was like, I love these locator implants. It was so easy to use. She had a lovely 89-year-old patient with a very narrow ridge. And she had planned to do 4 implants, and due to just some patient bleeding, she decided to only do 2 implants. And so she placed the 2 implants. She got a very good AP spread with those 2 implants and let the patient heal. During that healing process, since it was an overdenture, she hollowed out the denture for those implants to heal properly. And then once everything was healed, she was able to deliver that prosthetic for that patient. And the patient is really happy with the results of her denture. So this was right after surgery. And you can see that great AP spread and where we would have put those other 2 implants if if it was available to her. But the patient is very happy and is probably eating some really great food right now with those.
I say that's a great looking case. That's very nicely done. So, speaking of, so that complication that you had, can you just touch on torque value for our locator implants, just so doctors are aware of what that torque value would be?
So yeah, the torque value would be, you would want to get it to at least 30 Newton centimeters to 35 Newton centimeters. I mean, if you have a lower torque value than that, you want to make sure you let that heal. And you don't want to go over 70 as well. And I feel like these are normal protocols that you would do for your other implants as well when placing these implants.
So yeah, doctors that are comfortable placing their implants that are been in their office for a while, you feel that would be an easy transition to incorporate the locator implants into their practice?
Absolutely. And the best part is if you want to use the 2.4 and 2.9 in your narrow ridge areas, and let's say you can use a standard diameter in the back, and you want to use your normal implant line, you can do that as well, because Zest is a universal system. So as long as it's a locator, you can use everything Zest.
So you beat me to my question, is if I'm using a different implant system in the posterior, and let's just say locator implants on the anterior, are the abutments, they're universal. So do they work well in conjunction with each other?
They do, yes. The best part about Zest, because Zest is the best, is that top 1/3 of every locator implant or abutment, is exactly the same. So the fact that we're a universal system makes it really easy to mix and match your implants if that's something that you encountered.
That's awesome. Another question that's come in, Sonia, is one of our last locator lunches, we highlighted our locator angled. It's an angled abutment that corrects up to 15 degrees of divergence or convergence from an implant. And so the question is, can you use angled locator on your locator implant?
The angled abutments are absolutely amazing. Unfortunately, due to the external hex, we do not have angled abutments for our locator implants. But the best thing with Zest is that we have 2 different types of inserts. So we have our standard range inserts, which can accommodate up to 10 degrees of divergence. And we have our extended range inserts, which can accommodate 20 degrees per implant, or 40 degrees total divergence between 2. So if you do happen to have an angled implant, we can accommodate that with the inserts. And the locator fixed inserts can also accommodate up to 20 degrees per implant as well, if we have those angled solutions.
So again, with our locator our locator implants, if a patient's in an overdenture currently right now with our locator implant and our locator abutment for overdenture, and they do want to transition to locator fixed, if they already have 4 implants, they can just go right ahead and change the housing out and go to locator fixed, still using that same 1 implant. They don't have to change out any of the implants?
Correct. They don't need to change any implants. As long as you have your 4 implants and they're nicely integrated, you can transition that patient from their overdenture to locator fixed. So then we can go from, eating a sandwich to biting into an apple, which is amazing.
That is awesome. So another question that's come in is a doctor asking about learning more about, how to place locator implants. Do we offer any courses on, the surgical protocol and placing our locator implants?
Oh, absolutely. They should attend our Zest Mastership, where you can actually practice on a dummy mandible and inserting those implants. I was able to do that. It was really, really fun. And we go over that surgical protocol in depth, and then you can get hands-on experience using that implant on a fake mandible. And that's where a lot of my doctors have heard about our locators implants.
That's awesome. So on that, I know we could probably talk about this forever. Two hygienists here, love talking about dentistry, and like you said, Zest is best. So we love talking about locators. But I just wanted to thank you, Sonia, for joining me today. And I'd like to invite everybody watching today to please visit our website, visit zestdent.com, where you can learn more about locator implants, learn more about our locator fixed that we talked about today and our locator angled, and find out, like Sonia mentioned, about our Zest Academy, which is an amazing opportunity to learn online, and our Zest Mastership, which is a 2-day program, and we host it in our Las Vegas Education Center throughout the year. And we also have it remotely with our next Zest Mastership coming up. We have one in May in Las Vegas and one in Washington, D.C. So we're on East Coast and the West Coast, so to speak, for our Zest Mastership, which is, again, a 2-day, very intensive course where we learn everything locator implant, like Sonia talked about today, locator fixed and locator angled. So again, Sonia, I'd like to thank you very much for taking time out of your very busy day, helping to talk to us all about our locator implants, and thank everybody that's tuned in to watch us today. And again, I invite you to please visit us at zestdent.com and email us with any questions or reach out. And then I look forward to seeing you again. Thank you so much.
Thank you.